Hello everyone, Dr. Sam Schroetke here of Physical Therapy and Hand Clinic of Hillsborough with an update. So in a previous video I showed everyone the prone press-up, also called extension and lying. And I thought I'd do an update because I had a patient in the clinic yesterday who had been doing that but she wasn't responding to it. And so with a little adjustments we found out why. So what's important, if you have what's called a directional preference, that means your lumbar spine in this case, there's a specific direction that it responds well to. So when you do that direction, your pain goes down, your movement increases, and you have better function. So that's what we're looking for. So she was doing the prone press-up, which if you remember was hands underneath the shoulders, and then you just press up, locking the elbows out. So she was doing this, but it was helping a little bit, but not much. Not as much as it should have been, because she was doing 10 reps, say 5 times a day. But what I saw, what's important with these exercises is that you get to end range. So that means you're taking the joints as far as they can go. If you're not getting to what your end range is, it's not going to have that strong of an effect, or it's going to be limited. And everybody's end range is different. Okay, so if I'm working with a person, say who's 60 years old, they're not going to have as much mobility as a person who's, say, 24 years old. So in her particular case, she was doing the prone press-up perfectly, locking her elbows out, but she wasn't getting to end range, and I could see it just by looking at her, so she wasn't going to have the strong effect that the exercise can have. So we had to make a modification to get her to end range. And all we had to do for her was stack up some towels like this, and so now she's doing the press-up from the towels, and this got her back into the end range. So when you're doing this, you shouldn't necessarily feel pain, but you know you're getting end range when you get kind of this strain feeling right between your pelvis and low back. And so with this modification, she was able to do it. We did 2 sets of 10 reps, and then her pain was gone. So that's all it took. She just wasn't getting to end range. So with any of these, whether you're doing the prone press-up or that one where I showed you where you're going extension and standing, you've got to make sure that you're getting to end range. You might not be able to in the first couple of reps, but as you go, you should be able to get farther and farther to the point where you can't go any farther. So there we have extension in line with a modification to get you to end range if you feel that that exercise has not been working for you as well as it should. As with any exercise, though, this is not appropriate for everyone, so make sure to check with your physical therapist to make sure that it is appropriate for you. Thank you.